It has been estimated that low iron levels affect a whopping 2 billion people worldwide, making it the most common nutritional deficiency. If left unchecked, it can lead to iron deficiency anemia, which can be pretty serious. But don't worry, there are ways to naturally boost your iron levels and feel your best again. In this video, we'll break down the causes, symptoms, and most importantly, how to get your iron levels back on track using food, supplements, and simple lifestyle changes. Iron plays a crucial role in our health, helping to deliver oxygen throughout the body and fueling our energy production. However, our bodies carefully manage iron levels, as too much can be harmful. In adults, around 3 to 4 grams of iron are stored mainly in red blood cells, the liver, and bone marrow. When these stores become depleted, iron deficiency occurs. Now let's learn about some of the most common causes of iron deficiency. Number 1. The most common reason is simply not getting enough iron in our diet. The amount we need varies by age and gender, with adults typically needing 8 to 18 milligrams of iron daily. Premenopausal women have the highest requirement at 18 milligrams of iron per day due to blood loss during menstruation. Here's where things get a bit trickier. Meeting iron needs can be harder for people on plant-based diets. This is because iron found in plants is mostly non-heme iron, so it isn't absorbed as easily as the kind of iron in meat and seafood, which is known as heme iron. This means you need to be more mindful about getting enough iron-rich plant-based foods to compensate. Number 2. There are times when you need even more iron. During growth spurts, like for little ones and teenagers, or during pregnancy and breastfeeding, your iron needs might increase. If you're not extra careful about eating enough iron-rich foods during these times, it's easy to become deficient. Number 3. Losing blood regularly can seriously tap into your iron reserves. This is especially common for premenopausal women with heavy periods. Other culprits include slow bleeding in the gut, like ulcers, hemorrhoids, or even some cancers. These can slowly drain your iron stores over time. Number 4. While getting enough iron is key, your body also needs to be able to absorb it properly. Certain digestive disorders like celiac disease and inflammatory bowel disease can make it harder for your body to take up iron from your diet. Similarly, medications like long-term use of antacids, proton pump inhibitors, or certain pain relievers can also hinder iron absorption. So, while you might be eating iron-rich foods, your body might not be fully utilizing them. Now let's learn how you can tell if you're low on iron. At first, you might not even notice your iron stores are running low. Your body cleverly pulls from its reserves to keep things ticking over. But as these reserves deplete, you might start feeling tired and weak, experiencing muscle cramps, or getting lightheaded and having headaches. You might also find yourself feeling irritable, having trouble concentrating, or noticing your skin, gums, and inner eyelids looking paler than usual. These are early warning signs, and it's important to address them before things get much worse. If left unaddressed, iron deficiency can lead to a condition called iron deficiency anemia. This is when your body doesn't have enough healthy red blood cells to carry oxygen throughout your body. Symptoms of anemia include extreme fatigue, shortness of breath, feeling dizzy when standing up, and even chest pain. So if you have these symptoms, then you must consider yourself tested for iron deficiency. A simple blood test called a complete blood count can check your hemoglobin, which is the protein in red blood cells that carries oxygen, or the hematocrit, which is the percentage of red blood cells in your blood, and other red blood cell measurements. Healthy hemoglobin levels lie between 12 and 16 units for adult men, between 12 and 15 units for adult women, and 11 to 12 units for children aged between 6 and 11. Doctors can also assess your iron stores directly through specific tests like measuring serum iron, ferritin, and total iron binding capacity. If your ferritin level is below 12 to 15 units, it's a strong indicator of depleted iron reserves. Now, let's explore some of the top dietary strategies to meet your daily iron needs. Number 1. Focus on heme iron sources. There are mainly two main types of iron found in food, heme and non-heme. Heme iron comes from animal sources like meat, poultry, and fish. It's readily absorbed by your body at a rate of 15 to 35%. This is much higher compared to non-heme iron, which is found in plant-based foods and has an absorption rate of only 2 to 20%. Studies show that including red meat, poultry, and fish in your diet 2 to 3 times a week can be beneficial, especially if you're concerned about iron deficiency. A 3-ounce cooked serving of these foods provides around 1 to 3 milligrams of this highly absorbable heme iron. Number 2. Maximize absorption of non-heme iron. For those following plant-based diets, getting enough iron can be trickier, but it's definitely possible. The key is to focus on a variety of iron-rich plant foods like beans, lentils, spinach, nuts, seeds, dried fruits like prunes and raisins, peas, quinoa, and even fortified grains and cereals. But here's the trick. Studies show that pairing plant-based iron sources with vitamin C-rich foods maximizes iron absorption by up to 3 to 6 times. So if you want to get the benefit of iron from the veggies and fruits you're eating, or you're following a plant-based diet, then you must combine vitamin C-rich fruits and vegetables like oranges, bell peppers, broccoli, tomatoes, strawberries, or citrus juice with your non-heme iron sources. Number 3. Limit foods that inhibit iron absorption. Certain foods and drinks can actually hinder your body's ability to take up iron. For example, coffee and tea contain polyphenols, which can bind to iron and make it less available for absorption. So, avoid enjoying them right alongside iron-rich meals. Space them out by at least 1 to 2 hours. Similarly, consuming calcium-rich foods too close to iron-rich foods, like yogurt, milk, or cheese, can slightly reduce iron absorption. So consume them at least 1 to 2 hours before or after your iron-rich foods. Moreover, whole grains, legumes, nuts, and seeds contain phytates, which can also slightly hinder iron absorption. But their overall health benefits outweigh the minor impact on iron absorption. You can still enjoy them, just be mindful of spacing them out from iron-rich meals, or consider pairing them with vitamin C-rich foods to help counteract the effect of phytates. Number 4. Cook in cast iron cookware. Cooking with cast iron pots and pans can add small but helpful amounts of dietary iron. Acidic foods like tomato sauce that sit in cast iron for more than an hour can absorb 1 to 2 milligrams of iron per average serving size. While this won't meet your full daily needs, using cast iron cookware regularly provides a nice boost, especially for vegetarians and vegans who rely on non-heme sources. Number 5. Eat iron-fortified foods. When shopping, look for the "fortified with iron" label on your favorite grain and milk options. Many products like rice, pasta, bread, plant-based milk, and even breakfast cereals can be fortified with iron, offering up to half of your recommended daily intake per serving. Beyond just filling your plate with iron-rich foods, there are other ways to help your body maintain healthy iron levels naturally. Let's explore some of these additional strategies. Number 1. If heavy periods, gut problems, or a digestive disorder are affecting your iron absorption, addressing the root cause with your doctor is crucial. They can help diagnose the underlying issue and recommend the best course of action to get things back on track. Number 2. Adding a squeeze of lemon juice to your meals or having diluted apple cider vinegar can help increase stomach acidity, which aids iron uptake. But avoid doing your workouts right after eating. Intense workouts divert blood flow away from digestion, so take it easy for 2 hours after iron-rich meals. Light walks are perfectly fine, but leave high-intensity exercise before or well after a meal. Number 3. If dietary sources aren't enough, your doctor may recommend iron supplements. Consult them to explore safe and effective options like ferrous sulfate or iron bisglycinate. But remember that these are for temporary support. Prioritize getting your iron from food whenever possible. Always remember to wean off supplements under your doctor's guidance after your iron levels normalize. Number 4. Don't forget about vitamin A. Deficiency in this essential vitamin can negatively impact how your body utilizes iron. So, add plenty of colorful produce like carrots, sweet potatoes, spinach, and red bell peppers to your plate. Remember, iron deficiency can stem from various causes, and some might require medical intervention. Consulting your doctor is always the best course of action. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching, and see you in the next video.